Magandang buhay! This is your favorite doctor, Dr. Cosmiano. Welcome back to Docs and Talks podcast. And for today's brand new episode, we have two incredible guests who will be diving deep into the world of modern anesthesia techniques. Joining us is Dr. Reyes, a renowned surgeon from San Lazaro Hospital with a passion for improving patient outcomes, and Dr. LABUTAP, a highly skilled anesthesiologist from Tondo Hospital who keeps us all safe and comfortable during surgeries.
Thank you, Dr. Cosmiano. It is great to be here. You know, I am always happy to spread the word about how we are making surgery safer and more comfortable for patients. So, let us get into it.
Dr. Cosmiano, thanks for having me. I'm excited to talk about the latest advancements in anesthesia. And of course, Dr. Reyes, it's always a pleasure to chat with a fellow medical professional.
Dr. Reyes, Dr. LABUTAP, thank you both for being here. Let's jump right in. Imagine you're both in an operating room, about to begin a complex surgery. Dr. Reyes, you will play as Dr. Ramos, the surgeon, and Dr. LABUTAP, you will play Dr. Cruz, the anesthesiologist. Let's hear how this conversation might go.
Sure, Dr. Cosmiano. I would love to engage in this kind of role-playing scenario. So, allow us to start the conversation. Good day, Dr. Cruz. I would like to discuss some modern anesthesia techniques that we could use for our upcoming surgery.
Good day as well, Dr. Ramos. Yes, it is important to stay updated with the advancements to ensure our patients' safety and comfort. Do you have a specific technique in mind?
One I have been thinking about is using total intravenous anesthesia with propofol and remifentanil. It leads to faster patient recovery and lower incidence of post-operative nausea and vomiting.
You're right. Total intravenous anesthesia provides stable hemodynamics and more precise control over anesthesia depth. Aside from that, it is less likely to trigger malignant hyperthemia compared to inhalational agents.
Another thought is using regional anesthesia techniques like ultrasound-guided nerve blocks. They minimize systemic side effects and provide superior pain management post-operatively.
Yes, ultrasounded guide nerve blocks like brachial plexus blocks or femoral nerve blocks are excellent, especially for orthopedic surgeries, because real-time visualization during procedure increases accuracy and reduces the risk of complications.
It is always a way to minimize opioid use post-operatively, which is a big help considering the current opioid crisis. So, what about using multimodal analgesia?
Well, multimodal analgesia is an excellent approach for comprehensive pain management. And you know what? Combining different classes of medications such as NSAIDs, acetaminophen, gabapentinoids, and local anesthetics allows an optimal pain relief while minimizing side effects.
I agree. We should also consider enhanced recovery after surgery protocols that utilize multimodal strategies to accelerate post-operative recovery and shorten hospital stays.
Exactly. ERAS protocols are holistic because it includes pre-operative education, intraoperative fluid management, and early mobilization post-operatively. And these interventions have been proven to reduce post-operative complications.
What do you think about using dexmedetomidine as an adjunct to general anesthesia? I have heard it has sedative and analgesic properties that are also beneficial for hemodynamic stability.
Well, dexmedetomidine is indeed promising. It's an alpha-2 adrenergic agonist with anxiolytic and sympatholytic effects that help maintain stable blood pressure and heart rate during surgery. And it's also good for sedation in ICU settings post-operatively.
That's great! What if we try using nitrous oxide as part of our balanced anesthesia approach.
Nitrous oxide is another great option because it acts quickly and is easily eliminated from the body, making it easy to titrate according to the patient's needs. However, we must be cautious in using it for patients at increased risk for intraoperative awareness or those with high-risk cardiovascular conditions.
You are right. And we need to carefully evaluate each patient before deciding on an anesthetic plan to avoid any adverse effects or complications.
Absolutely. That is why pre-operative assessment and planning are really important to properly meet the individual needs of our patients while using modern anesthesia techniques.
That was a fantastic demonstration of how a surgeon and anesthesiologist collaborate to ensure the best possible care for their patients. Dr. Reyes, what are some of the key benefits you see in using these modern techniques?
Well, the biggest benefit is undoubtedly improved patient outcomes. We are seeing shorter recovery times, less pain, and fewer complications. That translates to better quality of life for our patients.
Dr. LABUTAP, from your perspective as an anesthesiologist, what are some of the challenges in implementing these new techniques?
Well, one challenge is staying up to date on the latest research and advancements because we are constantly learning and evolving our practices. Another challenge is ensuring that patients are properly informed and they understand the risks and benefits of different anesthesia options.
That's a great point to end on. Thank you both for sharing your insights, Dr. Reyes and Dr. LABUTAP. We've learned so much about the exciting world of modern anesthesia. Again, this is your favorite doctor, Dr. Cosmiano, and this is Docs and Talks Podcast.